have, on our table so that people are not wondering who's joined us. Professor Adeseye will be joining us for our Let's Talk topic. So,
2 Thessalonians 3:10. For he who does not work should not eat. So it doesn't say don't give, but give right. And give to people who can work so that they can multiply it. They can eat. 2 Thessalonians 3:10.
Thank you.
Do you have any closing remarks?
Begging I work. It's easy to start that song. Now you know try. It's okay. I have no closing remarks. I have said that government must do something about this.
True.
They must create the social welfare. They must create free education to get little kids off the streets, these exploiters, and put them in schools where they are safe. They must do much. They must create rehabilitation homes. Take people and put them in the right places and criminalize this sort of exploitative begging that we see on our streets. It's not healthy. For the mega city plan, for instance, for Lagos, which mega city in the Dubai and the Saudi that you go, do you see beggars on the streets? And these are cultures that encourage giving more than even when they give.
Okay, ladies, thank you for a holistic conversation. But let's go on to our Let's Talk. We have a very important guest with us. As we know, September, the spotlight is on most vulnerable amongst us, our children. As the world marks Childhood Cancer Awareness Month, behind the statistics are real stories of courage, resilience, and the urgent need for awareness, early detection, and support. Joining us today is Associate Professor Adeseye, a leading voice in pediatric hematology and oncology, and a board member of the Dorcas Cancer Foundation. With years of expertise and a passion for saving young lives, he will help us unpack the realities of childhood cancer, the myths that surround it, and the step every parent, caregiver, and community must take to give children a fighting chance. This is not just a conversation, this is a call to action. And to join us for this conversation, remember you can call us on 090-241-63440 or tweet us at TVC Connect using the hashtag YourViewTVC. Professor Akisheta, you're welcome to the show.
Thank you very much. Good morning. Thank you for
Good morning. I feel like our conversation that we've just had would work very well with what you're doing, because that you are committed, to saving lives, and that takes a lot of sacrifice. So for us, I think the first question is why. We know that September is the month that's been used to highlight childhood cancers. What is the message that Nigerians should be paying attention to, and how can they participate in this month's awareness?
So thank you very much for having me once again. And so September, basically, I think that what has occurred is that there has been a trust and a shift in paradigm that historically, we never gave any form of attention to childhood cancers. So what used to be was that breast, prostate, colon, adult type cancers were the emphasis for conversation. But along the line, the World Health Organization realized that, look, there are these vulnerable ones, and we need to actually dedicate a month to talk about the problems that they have, raise their awareness, and interestingly, let people realize that with childhood cancers, we can achieve cure. So we are not talking about managing the pain and the sorrow and just leaving it out. No, we're talking about actually getting cure, restoring the kids back to life, and integrating them back into society. And we started late in Nigeria, but I think that we're accelerating our understanding of what we need to do. So we're trying to do a quantum leap. We don't want to move from 1 to 2 to 3. We're trying to move from 1 to 10. And that's why all these concerted voices, Dorcas, several other ones in the play, and the media, which is instrumental to get the right kind of information, create the right buzz, and get the people to understand that, look, we have a stake in the tomorrow that we wish for our kids. Because it can happen to anyone.
Yeah. So when it comes to children, doctor, many of us try to pay attention right? And I've heard in some quarters that sometimes a sickness just keeps going on and on and on. You keep going to the hospital and they keep saying either is, you know, the names of the sickness where we know they pass. It's either it's malaria or it's typhoid. It's malaria or it's typhoid. And it takes a long time for a parent to now realize that this is beyond just malaria and typhoid. What sort of advocacy is, you know, this foundation doing in such a way that we don't wait for only September to make noise about it? Lots more parents need to be on board.
So thanks. I mean, you've raised something very valid, and that's that when it has to do with our kids, you know, parents want to get it right the first time. So let me just put it out there that in most cases, the healthcare ecosystem fails the children and their parents. So let me give you it. So we did a study some time back, which we published, and we looked at the first time a parent gets access to the healthcare system to when there is a diagnosis made. You have a time frame of close to 39 weeks. 39 weeks means that they keep going from one hospital to the other, from one healthcare provider to the other, and nobody takes a step back to say, look, I've been treating this child for this. This mom comes in all the time. What's wrong? So it takes them 39 weeks before they actually then get to a place where that child needs to get the right care.
And by then it's far advanced. So
predominantly, the narrative used to be, oh, the parents don't come on time. We've told people change that narrative. That's not true. We have failed to make the right diagnosis. You said it, malaria and typhoid. And what it just means is just an intellectual laziness. That's one. The second bit is that when people play God, you should know the limits of what, I mean, if I see a child the first time, I see it the second time, I should take a step back and in all humility say, so madam, I don't think something is right here. Maybe you should go to this place. But unfortunately, you see, we're a community of hungry people. So what drives us is our baseline hunger. So rather than me taking a step back and say, look, let me do what is right by you and your child, I'll just say, okay, let's go and do this test. And those tests don't even add up to make the diagnosis. So it takes us close to 1 year to get a diagnosis. And by that time, if we had caught it at the 6th week or the 7th week, so what the foundation did was flip the script and say, look now, take the training to the community, take the training to the nurses in the periphery, take it to the medical officers in the periphery. I'm of no use to the system if I sit in the university teaching hospital and I get the children at stage 4 when I can get them at stage 1. So now we're now teaching community health workers, we're teaching nurses, we're teaching medical officers to say, these are the common things. A mother brings a child to you, he has a fever, you've been treating a fever for 4, 5, 6 weeks. Get them to see somebody else. Don't need to do, oh, I'm doing primary health care to general hospital. Send them to the teaching hospital. We have details where you have a child who has never had a blood transfusion, and in the space of 5, 6 weeks, you've had 1 blood transfusion, the second one, this child is having headaches. And these headaches don't just seem to go away. Headaches in the morning, headaches in the afternoon, headaches at night, on Saturdays, headaches. Get them to go to somewhere else. One of the common ones, power goes off and the child's eye is just shining in the dark. Get them to go somewhere. So it's a whole new game we're playing. But what we know is that we need to be community responsive so that what you've said, we can then quickly approximate it. We don't want to be dealing in silos because our healthcare system, unfortunately, is fragmented into silos. And we're all very proud and arrogant people. I mean, I understand this is, that's what we are.
From what I hear you say, Doc, if symptoms persist after a few days, consult
your doctor.
Another doctor or a more advanced hospital. But with this change in measures that the foundation has been doing in training, healthcare providers, have you seen changes in the way the reports of children with cancers has there been improvement in the numbers that you now get and are there much earlier detection? So
thank you very much. So the first thing let's just put it out there that the real heroes are the children and their parents. Healthcare providers are no heroes.
Right now.
I don't agree, Sharon.
Right now.
I'm saying it with all the modesty. So why I'm saying this is this. I signed up to be trained for this role. I am doing what I want to do.
Okay.
So it's a privilege that a mother takes her child and brings to me. And I realize that every day, and I tell the people I work with. So we don't then say because we have the privilege of them bringing their child, we're the heroes. We aren't the real heroes are the mothers who go through grueling nights, the fathers, the children who go through grueling pain.
They didn't choose it.
So that's so when we put the perspective right, then maybe we can then address the real elephant in the room. So back to you. When we started, so the first set of trainings occurred about 3-4 years ago. Now we're seeing more referrals from those places. So health workers in Ogun State were trained. Health workers in some parts of Lagos State were trained. Now we're getting good referrals. Averagely now, we see over the last 3 years, we see 120 to 130 new cases every year of children. Historically, we used to save maybe 10% of them. Now we're saving 60-65% of them because we're getting them early. We know what needs to be done. We get financing which is dedicated and smart financing through Dorcas Foundation. We don't want walk-in donors, so we refer them to the foundation because we also want to be able to track what they are donating. They need to get feedback. Those are the things we've done over the years that didn't give us the right data that we wanted. So now we tell them, go to this foundation. There's corporate governance. For every kobo you give them, you get a feedback.
Okay.
Then the other thing is that when somebody gives money, they want to have a good story to tell. So we give them the feedback of the children that they finance the care. Some of them are in schools now, secondary schools, financed by donors.
Wow.
We have those we've treated who've gone through university. We have a medical student in training, a nursing student. So all of those things tell us that, look, the initiatives are working.
Yeah.
So what we need is to scale up.
Okay.
And finally, before we go to other things, is that we've now seen that for us to get better outcomes, we need to do finer diagnosis. That costs more than an arm and a leg. It costs a neck and the head.
Wow.
And so that's where we're going to now, so that we want to push our survival data forward.
Thank you, Prof. Let's go on a short break. When we come back, we'll continue with our conversation. Thank you for staying with us. We're still speaking with Professor Akin Shete on childhood cancer and Dorcas Cancer Foundation. YK, you had a question?
Yeah, I was going to ask how, because this is a laudable project and I know the foundation, and I mean, definitely this year Celebration is going to contribute something to the Dorcas Foundation. Amazing. No need to clap for me.
No, but
we didn't clap for you. We're clapping for Celebration.
No, we're clapping for the children who also be receiving this.
But how do you get support for this foundation? And because it cannot be easy.
Well, thank you, ma'am. So it's quite a challenging thing. But what we know is that Nigerians are a giving people. They support laudable projects. So we usually will do webinars where we, appeal to the public. We do fund the child initiative. So when we make a cancer diagnosis, we get the parents, they have a consent form which their rights are read to them, and we let them understand that we need to get funds to support your care. So if we take one of the commonest cancers we see, acute blood cancer to treat in children, the treatment is for 3 years, but there is an intensive phase where the child comes into the hospital for 6 months. That blood cancer would take about 10 million to treat. So we've done the buckets of the cost, what they need for drugs, what type of drugs. There are newer types of drugs now that you can use, but we don't go that way because the financing is not there. So then we appeal to the people and say, oh, this person needs 10 million to complete care. And then people begin to make donations and they get feedback on how the funds have been expended, because we find that that's the major thing that makes them return. Oh, I gave them 100,000 naira. They used it for this, and they gave me to the letter how much was expended on this child. So all of that has pushed us to push the boundaries of care. So all the common cancers we treat, we have their cost. we do some variations, you know, as to inflation and all of that. And then we get it out to the public that this person, and then when the kids finish, we still go back. X child needs to go back to school. Because the truth is that every parent, by the time they are done with the treatment, are flat out.
Thank you, Professor Akinshete, for your insights. Sorry, we've run out of time. And also for your commitment to saving lives, and also to Dorcas Cancer Foundation for doing the good job. This is what we've come to the end of today's show.
Can I just say something?
We have completely run out of time.
Like our governor.
Okay, but we have come to the end of today's show. Thank you for joining us, and we'll be looking forward to seeing you tomorrow.